In today's video, I'm going to give you an overview of the different components of ADHD treatment. But before we dive into that, if you have not been here before, my name is Matt Ryan. I'm a therapist and owner of Progress Therapy. We are a group practice that specializes in the treatment of ADHD. We do DBT therapy, CBT therapy, we do ADHD testing, and much more. If you want to learn more about our practice, go ahead and click the link down below and visit our website. But without further ado, let's jump into today's video. So in our practice, we've recently been reading the book Driven to Distraction by Dr. Edward Hallowell. It's a great book about ADHD. It goes through different stories, it gives examples, it shares research, it's educational, and it provides practical skills and tools. It's a book that has been helpful for both our clinicians and our clients. And in chapter 1, Dr. Hallowell gives us a synopsis of treatment for ADHD. And it's basically a list and a brief summary of the different components of treatment for ADHD. I thought it was a really good summary, which is why I wanted to make this video, which is largely based off of the list that Dr. Hallowell had in his book. Now, before we go through that list and we go through the different components, I want to make one thing really clear, and that is that ADHD treatment is going to look different for everyone, and it's often multifactorial. In other words, there are multiple components to ADHD treatment. There's medication management, there's coaching, there's therapy, there's education. There's all different components, and not everyone is going to benefit from every component. So for example, someone might benefit from medication management and coaching, while someone else might benefit from medication management, coaching, and therapy. Each form of treatment should be uniquely tailored to the individual. There is no one cookie cutter form of treatment for everyone. And so you want to keep that in mind as we go through this list. And the first one is diagnosis. We want to make sure that we are getting an accurate diagnosis of ADHD. That means we're getting comprehensive testing by a qualified professional, and we're not just being seen for 15 minutes and walking out with a diagnosis. And having an accurate diagnosis is extremely crucial because there are a lot of different issues that could present like ADHD and vice versa. For example, there are thyroid issues that might present like ADHD. And the last thing we want is to prescribe treatment for ADHD when it's actually a thyroid issue. And there's other issues like that as well. There's sleep issues that can present as ADHD. We don't want to prescribe the wrong treatment for the problem that someone is experiencing. We want to be as certain as we can that people are dealing with ADHD so that the treatment that we prescribe is actually effective, right? At Progress Therapy, we do comprehensive testing for ADHD. If you want to learn more about that, you can click the link down below in the description. Dr. Hallowell is huge on this next component of ADHD treatment, which is education. That's right. Simply learning more about ADHD, what it is, how it impacts you, is absolutely crucial. This not only gives us greater insight into what we're dealing with, but it helps us understand how we can best deal with it. Education, either through a clinician or even self-taught, is going to be crucial for someone's treatment for ADHD. Even more, as they gain knowledge of their own issues and ADHD, they can then teach their loved ones and the other people in their life about ADHD as well. This often eliminates a lot of interpersonal strains and issues that are caused from lack of understanding. Now, I mentioned before that you can begin learning about ADHD through your clinician or through other experienced professionals. You can also begin to learn on your own and self-teach about ADHD. The point is that you want to make sure that you're learning from credible sources. So my encouragement to all of our clients is to learn as much as they can about ADHD, while we also do a lot of psychoeducation as well. Another component of ADHD treatment is coaching. Now, coaching often gets confused with therapy, although they are different. And to put it simply, coaching is going to help clients with practical issues such as organizing, prioritizing, time management. A coach might go as far as helping a client actually write out a calendar, or might go as far as helping a client sit down and prioritize tasks. A coach is also going to provide encouragement and accountability. You can really think about a coach as someone who's going to provide practical support for issues that people with ADHD deal with. Now, another form of treatment is going to be therapy. And now therapy for ADHD might be a little bit different than what you would consider standard therapy, although there are some similarities. A therapist is going to use evidence-based skills and tools to help treat the symptoms of ADHD. Some of these tools and interventions might include DBT therapy, mindfulness, and other interventions as well. At Progress Therapy, we use a lot of DBT therapy to help treat ADHD. This is an evidence-based method that has shown to be effective for the treatment of ADHD. And in addition to learning evidence-based skills and tools for the management of ADHD, a therapist is going to be able to work with the client to explore their emotions, their past, to develop greater personal insights, which also can help in the treatment of ADHD. And another component of treatment is medication management. And just like it sounds, medication management involves being prescribed medication for the symptoms of ADHD. Now, I think it's really important that when you are prescribed medication, or if you're interested in medication for ADHD, you see a provider who is experienced in the treatment of ADHD. You don't want to mess around with that. You do want to make sure that whoever you see, whether it be an MD, an NP, it doesn't matter. Whoever is prescribing your medication, make sure that they have experience in working with ADHD. You definitely don't want to walk in, see a doctor for the first time for 15 minutes, and then walk out with a prescription that you don't know much about. Make sure you're informed, make sure they're informed, and proceed from there. Anyway, this is just a brief synopsis of some of the main components of ADHD treatment. I hope you found this video helpful. I hope you learned something. And until next time, we look forward to seeing you soon.